had an email last night from Acting Secretary Julie Su informing me that she was unable to attend because she's called away for an important issue that required her to travel. So we have a very able substitute, Mr. Brent Parton, who I've seen on stage on several occasions. The last time was at JFF, when he was on a stage at the executive CEO little room. And Brent's command of all things workforce policy, how the system works, how it should work, was extraordinarily impressive. And that came out of, I read your background, it really came out of a background in the think tank community and research. And I think we could not have asked for a better person to be part of this conversation than you today. So thank you for coming at such short notice.
Thank you. I'm not Julie Su, and I have to follow Wes Moore, so wish me luck. Good to be here, though.
Thank you. Let me find. So I'm getting my order correct.
No worries.
There we are. So Brent, and your staff are here too, by the way, so thank you for coming out this morning.
ETA, yeah.
Yeah. So Brent, back in 2014, in fact, what is your background?
Sure. So my background is, well, I'll tell you what I currently am. I'm the Acting Assistant Secretary for the Employment and Training Administration, or ETA. We oversee about $4 billion in workforce investments across the country each year. Most importantly, we help implement all the programs associated with the Workforce Innovation Opportunity Act, alongside partners, including, of course, CSEP, or the Senior Community Service Experience Program, which is one of our marquee programs for serving older workers. But my background is I've worked with states, local communities, and actually even international development on workforce skills development for about almost 2 decades. I've had the opportunity to work with incredible governors. I've had the opportunity to work with mayors. I've had the opportunity to work with the public and private sector on workforce. But it's to lead ETA at a really critical time of these past couple of years has been the great honor.
What are the challenges of working within the Department of Labor during a pandemic that pretty much froze the economy? Well, how was it? How did you guys get through it?
Yeah, good question. Well, I would put it this way. I'm a political appointee, so I showed up in the pandemic.
Wow.
And so I say that in part to give credit to a lot of the folks sitting here today who are our career civil service leaders and civil servants within the Department of Labor, Steve Riskey, Tony Wilson, who's here, who work incredibly hard, of course, on the CSEP program across a number of things. But I'll say this, because I'll give you a view of what it looked like. A lot of the work that the Department of Labor does, but most critically the Employment and Training Administration, is about putting out fires. We obviously oversee the nation's unemployment insurance system. That's been in the news a little bit since the pandemic. We oversee dislocated worker programs, disaster grants. There were an entire round of investments in communities to help them deal with COVID and COVID-impacted communities. So much of what we do is respond when individuals lose their jobs, and what we went through in the pandemic, I think no one could have foreseen the unprecedented nature of what that meant for our labor market, how important it was to put income in people's pockets to keep the economy going. So that was underway. And the folks who work within the Department of Labor showed up. They were there. And the fact that the economy didn't experience the type of, downturn, or I will always remember someone said digging wells in the backyard in the early weeks, has a lot to do because of Congress, the administration, a different administration at the time, but our civil servants showed up.
Yes.
The issue now, though.
I have to say, though, we went through the first month of the pandemic. when we engage Steve and Tony on a number of issues around how to make the program function and still release funds to those in most need, the response was remarkable.
Yeah.
So I have to credit the professional staff, the civil servants, for their responsiveness to people like us on the outside.
I'm glad to hear that, and I see it. And I've seen it in those grants. I've seen it across the board. And I will say it's our federal staff, but it's also the folks that work in the state and local level and the community-based organizations who are on the front lines of providing those services. We saw the public workforce system, which is a massive infrastructure, pivot to virtual services, which I will say in a timeline of how long it takes to implement things overnight. And they stayed open. And I think going to maybe where we can talk next, the great mistake would be to not learn and build from that and try to go back to where we were. Yes. Because the resilience, not just of grantees to get, of course that takes responsiveness, it takes a spirit of how can we use our resources in different ways, but it was this recognition that so much of what our public workforce system does is, yes, we're there to build, and I think we're very much right now in a posture to building the next future, building the next economy, but at the end of the day, we're there to respond.
Yes.
And the pandemic put that to the test in ways that I don't think anyone could have predicted, but it responded in ways. But I have to be very honest with you, we're digging out of that still.
Wow.
40% of the people within my agency have been there less than 3 years. Those numbers are higher at our state and local governments, and I know there's been incredible turnover within nonprofit.
One more time.
40% of our staff, our federal staff, the Employment and Training Administration, have been there less than 3 years. So what you are seeing, what the pandemic has created, is churn within our labor market, but churn within our own workforce. And I hear that from community-based organizations. I hear from national workforce organizations. So here you have an incredible challenge in that you have so many people who may be new to the field or new to the organization, who maybe have been operating in post-pandemic realities, trying to figure out kind of where we go from here. And so I think that's something that is it's easy to say challenges and opportunities, but this is definitely a real one.
Wow, thank you for that response. I have 4 very important questions for you, Brent. So, number one. In order. So back in 2014, the Workforce Investment Opportunity Act was reauthorized with several key purposes. Amongst other key priorities, promoting improvements in the structure and delivery of services and increasing prosperity of workers and employers. Now we're almost 10 years on. How has the U.S. Department of Labor working to advance the goals of WIOA to strengthen the workforce system and better support individuals?
I think it goes back to what we were just talking about, is that it would be a mistake to not learn from what we've learned over the past several years and try to respond to where we are today. WIOA, any federal law for that matter, at the end of the day, it's about, yes, resources and rules, but it's a platform. It's a platform for how you do things that matter and drive outcomes. And I will say, the Department of Labor has great discretion in being able to drive priorities within that system, recognizing always it's a federal, state, local partnership. I would say there's several things that we've learned, that we have prioritized, that we are trying to do now. The law is scheduled to be reauthorized, and that's what we rely on our partners in Congress to make sure that happens.
Next year?
It's actually already ready, but what's ready and what's timely is an abstract concept, but it's one that Congress, there are really exciting discussions happening on that front. We're engaged, and the administration's engaged on that front. But here's what I'm going to say is, if we're not very clear about where the workforce system needs to go and showing what that looks like now, then we're prone to pursue reauthorization as tweaks and just getting the job done, as opposed to really transforming that system. And I would say number one is how we start to center that system on equity. And that's easier to say. It's very easy to say. We hear it a lot. but it means something to us. And what it means to us is very complicated things that make equity an outcome are the things we need to be focused on. Equity is an outcome. So when, for example, the performance metrics that guide a system's behavior are undermining serving the hardest to serve or the people who need the most support, we're not viewing equity as an outcome. We're trying to serve more as opposed to serve the folks who need us most better. Equity is an outcome when you partner with organizations that have centered on that as an outcome. So we are looking at our grants and how we invest and trying to open up access to new organizations, but also to folks that are very much clear-eyed on the outcomes they want to deliver equitable ones.
Brent, you answer like the governor. You were
Yeah.
here for us. You're not answering the next question, so please stop.
Well, let me.
We'll get to equity soon.
Well, let's off equity then. I will say, it's all connected, but I think another big priority is another thing we've learned in this recovery.
Yeah.
You can't have a functioning labor market without a functioning care economy. And the idea that care, we hear this word supportive service. So there's training, but then there's all the stuff around it, right, that we hear in workforce development. Care is a core supportive service. And when I say that, I mean that in terms of access to early childhood care, access to long-term care, access to mental health, particularly when we look at the populations that have been through a lot of trauma, have lost loved ones,
Yes.
who have been disconnected from systems and work for years. The biggest barriers today to our labor market are not skills and credentials. There's motivation there. There's programs there. It's how do we get people in? How do we help them persist? How do we help them succeed and connect to jobs on the other side? And I think if you ignore the integration of care and workforce development as a seamless service, we've missed the biggest lesson of all that the pandemic's taught us.
We don't hear enough about care.
Yeah.
Why is that? We hear about the need to fill jobs,
Yeah.
but not the impediments and challenges people are confronting to facilitate their re-engagement. Why is that?
Talking about a skills mismatch doesn't cost a lot of money. Fixing the systemic barriers to how we actually get access to high-quality training programs and high-quality jobs in our economy definitely takes resources. And this goes back to my point on equity, so I'm doing my best not to skip ahead, but I'm going to say it. If we're measuring our success in our workforce system by serving the most, even though the services we're providing are not always the intensive, more expensive things that are going to deliver better outcomes, are we using our resources right? Is a fair question to ask. And it's a hard question. I want to be really clear about that. We all have goals. I know for those of you who have our grants, or if a state agency or local agency, yes, we have governors that are data-driven. They want numbers.
Yeah.
But what we're saying is take a beat. What do those numbers actually say? How do they compare to what's happening in your local labor market? And have that inform how you deploy resources. So I think there's an issue around care, number one, that it's resource intensive. It requires partnerships that we always say is at the core of what workforce development is, but it requires bringing in new actors that can bring those services to the table. The last thing that I will say about care is that we have a huge problem just in the care economy's own workforce. Access to those services, particularly for those that don't necessarily have the resources to pay, is a systemic problem across the board. A big challenge of why we don't have workers in the care economy is many of the jobs that are providing those core services are not necessarily high-paid jobs. So we have a profound job quality issue itself within many of those critical care jobs. So when I say one of ETA's we have 4 priorities, it's equity, it's partnerships for good jobs, it's building a better care economy, and it's the future of work. When I say the care economy, it's not just care as a supportive service, it's care as of how do we not be afraid as a workforce system to engage with sectors where historically there have been low wages, but figure out where the partnerships are in place to provide the career pathways, to work with partners that provide family-sustaining wages. Those are the ways that we get out of this issue. So I think care is hard because it costs money, yet at the same time, we have profound issues in terms of access because of the lack of investment in that space.
Thank you. A lot of us in this room are connected through the Senior Community Service Employment Program, CSEP. This is my last question. I'm being given all kinds of signals. I apologize. We are an aging workforce.
Yep.
Too often the narrative we hear and the approaches that we talk about are programs that is geared towards younger job seekers, not Americans who are aging, not a population that's going to become one of the largest segments of the workforce within the next 5 years. What can we do to pay more attention and get more resources into program activities that helps us meet the needs of older job seekers?
Yeah. Well, first off is don't fight with math. And the math that you've cited is very real. I think we've seen estimates and numbers, but across the board, the labor force is going to increase somewhere on the margins, 70% of increase in terms of how much of the labor force is age 60, 65 and over. Yes. And so that's math. And also in the news at the same time is what we hear about shortages, challenges finding talent. So on one hand, you have to ask the question, how do I put those two pieces together? Now you get into the questions of, well, how do we resource the programs that are actually successful at doing that? So one, I think we have to continue, and I would never tell you to educate members of Congress. That's not my job, but I think it's important to raise the facts around the changing labor market.
Mr. Parton, we do educate very well.
I'm just not asking you to do it,
no, you can't,
to be very clear. But
we chose that line very carefully.
Keep up the great work.
Yes,
but the other part of this is I think we do have work to do, and I'm happy to say our team at the Department of Labor is working with our evaluation office, is we have to elevate what works. And we are doing an evaluation of the CSEP program. I see that as a massive opportunity to be able to demonstrate that when you bring together the right workforce strategies, when you are intentional about actually building a grant program around a population that has specific needs, then you are actually in a place where you can show why there's evidence for why this works. So keep pushing and innovating and doing different things to serve a particular population. That is what makes our workforce system special, is that we target resources in certain places, but we always have to continue to build the case for them. And I think we'll do our part on the evaluation side. We need you to do your part on the innovation side. The last thing I will say is I don't want to put this in a position of it's our older Americans versus our youth investments, because I'll be very frank, I don't think we do investments enough in either. I think that we often play in the middle in some low transaction cost kind of ways. And I actually believe, and I've seen it with really innovative programs and partnerships, is that we have a major deficit of experience and mentorship in this country. And to hear what the governor's saying about service, to hear and recognize that we have generations of young people who don't have the FBI, the friends, brothers, and in-laws in their communities that help them get introduced to a labor market, get introduced to their communities, I think we can bring those strategies together. We talk about 2Gen a lot, and it means something. I think we need a macro approach to that. And when I look at all of the work that CSEP grantees do, and I look at the work that our youth grantees do, they complement one another in incredibly powerful ways. But most importantly, at a personal level, if we are truly going to value every worker and every person in our community and provide that meaning and role, what better way is there to do it than to solve two problems at the same time? And
Mr. Parton, I have to wrap up.
I would love to see how we make that happen.
I offer one request of you and your colleagues as I wrap up. We have to support and protect the CSEP program. We have to grow the program, and we have to withstand efforts to destroy the program because the need is so great.
I could not agree more, and I will say the Older Americans Act and reauthorization is something that I know our department, it starts with listening to our grantees. We have to protect the program, we have to protect the investment. We also have to continue to equip our partners on the ground to get done what they want to get done. And so our ears are open, and we're here with you and looking forward to working with you on that work going forward.
Appreciate it.
Yeah, thank you.